The opinions and approach to counseling described in the program are presented as an educational service intended for medical professionals only and not as a substitute for professional advice or intervention. They do not necessarily reflect the views of Roche Biomedical Laboratories and are not intended as a substitute for medical advice or education.
Hi, I'm Dr. Elion. How can I help you?
Well, I'm here because I want to take the AIDS test. I'm concerned because of a rumor I heard from a friend recently. A guy that I was seeing a little over a year ago was an IV drug user. I didn't know that then, and now I'm afraid that I might have AIDS.
Do you have any symptoms that you're worried about?
No.
Have you had any weight loss or any fevers?
No.
Any sweating at night? Any diarrhea?
No.
Any skin rashes, blotches on your skin, anything, any funny illnesses that you might have had?
No, nothing like that.
And how about your exposures? Have you, you said that you were exposed to a guy who was an IV drug user.
Yeah.
Did you have sex with him without a condom?
Yeah, I was on the pill then.
Uh-huh. And have you been having sex in the last few years without a condom pretty regularly?
A few times.
Mm-hmm. Have you ever used IV drugs yourself?
No.
Okay. Have you had any transfusions in the last 10 years?
No.
Okay. The AIDS antibody test, more accurately called the HIV antibody blood test, can be a very confusing and anxiety-provoking interaction between patients and healthcare providers. HIV is the human immunodeficiency virus which causes AIDS. It's very important that we, as healthcare providers, are sensitive to the psychosocial, political, and medical aspects of the test. In addition, we must prepare ourselves to counsel patients and attend to patient questions and concerns, because the key is prevention, and patients must understand what the test means and how to protect themselves from transmission of disease. I'm Dr. Richard Elion, and with me is Dr. Amy Gelfand.
Dr. Elion and I are both family physicians, and we practice at a neighborhood health center in the East Village of Manhattan. This center functions in part as a major alternative site HIV antibody testing center for the New York City Department of Health. Since 1985, we have been involved with the testing and care of patients in 4 categories: those patients with concerns about AIDS, those with HIV antibody positivity, those with AIDS-related complex, and those patients with AIDS.
The key points to cover in initial counseling session include assessing patient risk behavior and any symptoms, encouraging risk reduction behavior, discussing the appropriate time for the test, planning for the results, and explaining all aspects of this informed consent blood test. The points we cover in these counseling sessions are outlined in the physician guidelines that you received with this telecourse. In this program, we will interview 3 patients based on these physician guidelines. Please note that we chose only 3 patients because of time constraints. These pre-test guidelines are applicable for any and all at-risk individuals who request the HIV antibody blood test, as well as in situations in which you suggest testing. Let's continue with the first patient interview, and then we'll talk about the specifics of how we do the counseling. So the last time you had unprotected intercourse was?
At least 8 months ago.
Well, based on what you're telling me, I think this is a reasonable time to think about taking the test. The HIV antibody test is an indirect test. It doesn't measure the virus. It measures the body's response to the virus, the production of an antibody. It takes somewhere between 3 to 18 months, and taking the test at 6 months after you've been exposed is a reasonable time to take the test. The test is not 100% accurate. There are some times where the test isn't accurate because the body hasn't produced the antibody yet, and there's some times when it's not accurate because we get false positives. I think, however, just concentrating on what the test means is not the real most important thing here. The most important thing is how to prevent yourself from being exposed to the virus. It's really, really important for you to use condoms every time you have any kind of sexual contact. Anal sex, oral sex, or regular vaginal sex. You have to use condoms every time for the whole time. That's really important if you're going to not be exposed. If there's any bleeding or any blood products, you need to be certain not to be exposed to that either. The hardest part about being worried about AIDS, being worried about this test, is the issue of uncertainty. There's uncertainty if you take the test and the test is negative, because if the test is negative, it means that the test might really be negative or it might turn positive later. And if the test is positive, there's uncertainty whether you're ever going to get the disease or not. The medical reasons for taking the test, aside from your own personal reasons for wanting to know, are two reasons primarily. Number one, if you would get pregnant, it's very important to know if you're carrying the virus or not, because the risk of transmitting the virus to the unborn child is 50%. The second important reason is that in certain cases, if we can find somebody who's infected at an early stage, there are certain medicines which may improve your chances. However, it's hard to know if you're in that second group or not. Based on what I'm telling you, I think you have to understand that it's really a personal choice what you would do. What resources do you think you'd have to deal with all these questions? If telling you with all the uncertainty you'd have to deal with, how do you think you deal with that?
Well, I've talked to some of my friends about it, and I know that if I did find out that I was infected, that they would give me a lot of support, and I wouldn't be alone with it.
Okay, I think that's very important. I mean, we have estimates there might be as many as 500,000 people who have been exposed to the virus in the United States. And so you're not alone. It's important to know where your resources would be and how to use them. I think this is a personal choice ultimately. You have possibly been exposed to the virus. You have had some unprotected intercourse. I think the choice is a personal choice. It's your choice and your choice alone.
Well, I guess before I decide, I'll just have to think about it some more.
That's fine. Just let me know what you'd like to do, and you're free to come back and take the test at any time. One of the most important points in that patient counseling session was the opportunity I had to educate the patient about risk behavior. This is the time to counsel your patients on how they can actively reduce their chances of exposure to the virus. This means that sexually active individuals must use condoms, and intravenous drug abusers should get help to stop using drugs or learn how to clean and stop sharing their drug works. The second point that I must stress about offering this test to patients is that this undertaking requires your time. You as the physician need to help a patient understand what the test means, what the limits of the test are, and then, most importantly, the psychosocial implications of the test and the risk reduction practices to prevent further exposure.
In addition, before a primary care physician begins to do this counseling and testing, he or she must have access to services for the patient. This means that if you are not able to provide direct patient care of this type yourself, you must establish contact and referral procedures with the closest treatment center or infectious disease specialist in your area. The reason that this is now so important is that treatment may be indicated for some asymptomatic patients with antibody-positive status in whom subsequent testing reveals a diminished T4 helper cell count. Also, you must be prepared to offer specific information on counseling services and support groups to the antibody-positive patient during the post-test visit.
It's also essential for the physician to develop a system of confidentiality and anonymity. The specifics will vary with each setting. It's important to consider whether it is necessary to place the antibody results in the patient's regular medical record. For example, if the patient had HIV-associated symptoms and this information was needed for ongoing medical workup, then it might be helpful for it to appear in the patient's regular medical chart.
Keep in mind that many of these patients are healthy, and this information may not be germane to the medical workup. If the results were placed in the medical record, the patient could be subjected to discrimination from their employer, landlord, or insurance company. So it is vital that you try to protect the confidentiality of the test results, consistent with the requirements of applicable law. As you saw in the first interview, it is essential to ask the patient about high-risk behavior. Risk behaviors associated with the AIDS virus include using intravenous drugs in the past or presently, presuming shared needles or works, having sex with an IV drug user, receiving a transfusion prior to the spring of 1985, or having a sexual partner who received a transfusion. Other risk behaviors include unprotected male homosexual or bisexual sex, or having a sexual partner with an unknown history. In addition, there are 4 medical indications for taking the test. These include 1. Pregnancy or a couple considering pregnancy with a history of possible high-risk exposure. 2. Blood donation. And 3, organ donation. In the case of pregnancy, there's about a 50% chance that the virus can be transmitted to the baby. The 4th category includes patients who have a convincing history of high-risk exposure and are asymptomatic. The test may be medically indicated because early treatments could be appropriate for certain antibody-positive, yet asymptomatic patients.
When assessing the appropriate timing of the test, you should ask the patient about his or her most recent high-risk exposure. If their high-risk exposure was less than 6 months prior to being tested, they should understand that a false negative result could occur because the virus antibodies have not yet developed. Explain to the patient that a 12 to 16-month waiting period may be necessary and suggest future retesting if the window period is not over yet and the patient still wants the test done immediately.
How can I help you today?
I'm interested in getting the AIDS test. My lover has had the test and several of my friends have, so I'd like to get it as well.
Okay, let me ask you some questions about your health history first, and then we can talk in greater detail about the test.
Okay.
Have you ever received a transfusion or been with a sexual partner who received a transfusion?
I've never received a transfusion, and I don't believe I've had any sexual partners who've had transfusions.
And have you ever used drugs intravenously, sharing needles or works, or had as a sexual partner anybody who had?
No, I have never myself at all, and I try to keep the people that I have not being those types. So I don't believe I have, but I can't be exactly sure.
Have you ever had sex with a man or a woman without using a condom, such that you took either semen into the body or had contact with vaginal secretions?
Yes, I have. Prior to about 4 years ago, I have had received semen both anally and orally, and I've also had sex with women, but I used condoms then mostly as a preventive against pregnancy, but I did use condoms.
And 4 years ago was the most recent time that you've had that contact?
Yes. When I found out about this, when this all came out in the news, I just basically said, I don't want to fool with this, and immediately went to using and following the safer sex guidelines that were in the newspaper.
I'm glad you mentioned the guidelines. Those guidelines mean that every time you have any sexual engagement, be it anal, oral, or vaginal, you must protect yourself and your partner or partners with condoms.
Yes, and I have done that. As of 4 years ago, I started. But I have to ask, due to recent reports, is it still valid or is it still worthwhile to use a condom during oral sex? Because of the saliva not being as efficient a transmitter of the disease, I begin to wonder these days.
It's a good question. It raises a few points. Certainly saliva is not a very efficient means of transmitting the virus. However, sexual involvement where there's a lot of deep French kissing and a lot of saliva exchanged is still not advisable because there's a very small chance that it could be transmitted in that way.
Yeah.
And the other thing about oral sex is that although you may not feel that there's an obvious ejaculate, there still could be some pre-cum or a little bit of semen that could be transmitting the virus, and the recipient could have some small tears or breaks in the lining tissue of the mouth that could also facilitate the transmission of the virus.
Right.
So you do have to use condoms all the time.
Yeah. Okay.
Now, prior to 4 years ago, when you started to observe the safer sex guidelines, had you had as a sexual partner anyone who has since become ill with either AIDS or AIDS-related complex?
No, I don't believe so. No.
Have you been in good health generally?
Yes, very good health, actually.
Have you had any episodes of fevers, chills, or significant sweats at night?
No.
Any persistent diarrhea or persistently swollen glands?
No.
Weight loss that you have not provoked by dieting?
No.
Any unusual white coating in the mouth or on the tongue?
Nothing unusual.
Or any suspicious or unusual purple spots on your skin?
No, not at all.
So you've been enjoying good health?
Yes.
Okay. Have you read about this test? Do you know what this test is capable of telling you?
Yes, I understand that, from what I read, that it's a blood test and that it can tell me whether or not I've got AIDS, I assume.
Well, basically that's right, but actually the test cannot tell you if you have AIDS. The test can also not tell you if you will ever become ill with AIDS or AIDS-related disease. The test can tell you if you've ever been infected with the HIV or AIDS virus in the past. Now, there is a small chance that you could get a false positive result, which means that if you have never been exposed to the virus in the past, the test may actually come up positive. And there's also a chance, a very small one, that you could have a false negative result. And this means that although you have had true infection with the virus in the past, the test may not reveal that. That false negative happens more often in a situation where a person takes the test before 6 months have elapsed. In this situation, the person's body has not had enough time to produce an antibody, and this would then result in a negative test. Now, let's just assume that you decide in favor of taking the test today, and we meet again in 3 weeks to discuss the results. Let's just play out how you might respond to news of a positive result.
Well, I guess I would be upset, but I think I'd be able to handle the information, because I realize that it doesn't necessarily mean that I have AIDS. And I guess I would just continue to do what I have been doing, because it's the most intelligent thing to do, is to practice the safer sex, whether I have it or not.
Mm-hmm. Yeah, that's good. I think you do understand that your behavior doesn't need to change substantially.
No.
You do need to continue to protect yourself as you have been doing.
Mm-hmm.
I think you understand the limitations of the test. Now, in terms of the last possible high-risk behavior, you're sure that that was 4 years ago?
Yes, definitely.
Absolutely certain?
Definitely 4 years ago.
Okay, this is certainly an appropriate time to take the test then.
Okay, well, let's take it.
Before the patient decides whether or not to take the test, he or she must clearly understand the meaning of a positive and negative result. The patient information handout that you were given with this videotape explains the meaning of a positive and negative result. We recommend that you give a copy of this information to any patient who comes in requesting the test and discuss it with the patient in detail. This is also the time to discuss how patient confidentiality is handled. Explain the procedure to the patient and show them that their name is not used on any documentation where such a procedure can be used. It is also important to consider the patient's motivation. We often ask patients, "Why are you interested in taking this test?" This helps to explain why the patient thinks he or she is at risk, and it helps you to gauge their understanding of the test. Let's watch as Dr. Elion conducts an intake interview with patient number 3.
Hi, I'm Dr. Elion. How can I help you today?
Well, I think that I might have AIDS. With everything I've read in the paper lately, I think I might have been exposed to it somehow.
Well, let me ask you some questions about your health history for a second. How do you think you might have been exposed? Have you had any blood transfusions or any sexual partners who've had any transfusions?
No.
Have you used any IV drugs or had any sex partners who've used IV drugs?
No.
In terms of your sexual preferences, have you had sex with men or with women as well?
Just men.
And when you've been with men, have you been exposed to semen or blood products?
Well, if you mean do I use a condom, yes. Every man that I've ever slept with, I've used a condom the entire time.
Does that mean you've used a condom for both oral and vaginal and anal sex?
Yes.
Okay. Have you had any different symptoms lately? Have you had any weight loss, any night sweats?
No.
Any diarrhea, any problems with any whitish coating in your mouth?
No.
Any strange rashes, any skin problems or anything?
No.
So basically you've been in pretty good health, right?
Mm-hmm. Yes.
What are your concerns then with this test?
Well, I know that it's passed sexually, but I don't know about toilet seats or shaking hands or sharing each other's food Or, I don't know, if someone coughs on you, I spend a lot of time with people and I get nervous about it.
Well, I appreciate your being able to talk about your fears. I know that you've read things in the newspaper, and that's one thing, but your fears are another, and that's important. I think there's three things you should remember about the way the AIDS virus is passed, and there's three ways that it happens. One is through blood, one is through semen, and the other is through vaginal secretions. And if any of those three different substances come in contact through any mucous membrane or through any open cuts in the skin, the virus can be passed. The virus is not passed in other ways. It's not passed through saliva. It's not passed by someone sneezing near you. It's not passed by sharing a toilet seat. In studies where they've looked at families who live with AIDS patients, nobody in the family, if they haven't had any of those exposures, has gotten exposed to the virus. It's not passed by sharing glasses, silverware, or eating food together. Well, the amount of sexual contact you've had and the fact that you've used condoms and been protected every time puts you at very low risk. There are some problems with the antibody test that you should understand. There's a certain amount of the tests, that very small percentage, that are false results, false positives. Is that a risk you're willing to take?
I'm not sure. Maybe not.
And are you planning on having children in the near future?
I'm not sure about the near future, but probably eventually. The man that I'm currently going with, he and I have been talking about marriage.
Well, one possibility, if you're in a mutually monogamous relationship, is that instead of getting the test separately by yourself, you could come in and get the test together. It would be possible to get the test at the time when you're thinking of getting pregnant, because it's very important to get the antibody test before you get pregnant, because there's a chance, if you're pregnant, of passing the virus on to your child. But I think the most important thing is to, number one, consider taking the test together as a couple, and to two, the timing of the test be close to the time when it would make a difference as to what you would do. In other words, the time when you'd be thinking of getting pregnant. Okay. So do you think you want to take the test?
Well, based on the history I've given you, it sounds like I'm in a low-risk group. So I think that I don't need to take the test at this time.
Once you have given the patient all of the information needed to make an informed decision, it is ultimately the patient's decision whether or not to take the test.
If the patient decides to take the test, I usually make an appointment about 3 to 4 weeks later to discuss the results. I never give the results over the phone or by mail. I only give results in person, again, to ensure confidentiality and to help the patient cope with the findings, whether they're positive or negative.
In the follow-up session, the same advice and concepts discussed initially should be repeated. This is the time to reiterate risk reduction techniques and safer sex guidelines. When reporting a confirmed positive test, you should reassure the patient that he or she is not alone and that there are resources and services available to them. The points to discuss in post-test counseling are listed in the physician guidelines.
In the counseling sessions that follow, patients number 1 and 2 return to learn their test results.
Hi, I have your test result back and your test is negative.
Great.
Now,
Wonderful.
there's a very small chance that it could be a false negative, but the test does indicate that you have not been infected with the AIDS virus.
Good. Thank you. That's fabulous news. That's just what I wanted to hear. Everybody will be pleased. Thank you.
Great. Now, remember that in terms of the future, the name of the game is prevention, and just because the test is negative now doesn't mean it's always going to remain negative. If you do have any high-risk, unprotected behavior in the future, the test could indicate that. It could convert, you could become infected with the virus. So you need to continue to protect yourself as you've been doing.
Thank you very much.
You're welcome. It's really nice to be able to give that news.
Yes, yes.
If you do have any questions that arise after this or any concerns, give me a call.
Okay, I will. Thank you.
Great.
Your test results are back, and the test is positive. Let me explain to you what that means, okay? A positive result means that your blood has been tested on 2 separate tests, and on both tests it shows that you are positive for having produced an antibody to the AIDS virus. You understand that?
Well, does it mean that I have AIDS?
No, it does not mean that you have AIDS. It just means that you've been exposed to the AIDS virus and produced an antibody. It does not mean that you have AIDS right now.
Well, I mean, what am I supposed to do? I mean, does it mean I'm going to get the disease?
Well, if we look at the current time, when we look at large groups of populations, it looks like about 1/3 of the people who are positive for the antibody test will develop AIDS within 8 years. And about 2/3, or somewhere between 65 and 70%, don't develop any AIDS-related disease. And so what you and I have to work on together is making sure that you're in the group, that's the 65 to 70% group, the group that doesn't get any AIDS-related symptoms.
I didn't know there was anything I could do.
Well, there's a lot you can do. There's really a lot we can do. And let's talk about that. The first thing we can do is just sort of start to do things that are sound nutrition, are common sense kind of things, getting enough rest, not drinking and smoking, taking good care of yourself. Second of all, there's some blood tests that I think are worth taking. It's important for us to know what the status is of your immune system, and there's a particular test, the T4 test, measures a certain part of the immune system that the AIDS virus affects in particular. That'll help us to know exactly what the status is of your immune system and see if there's any medicines that you might be a candidate for. The third thing is to think about making sure that you don't pass the virus on to anybody else. It's possible when you have a positive result like this that you can infect other people. Therefore, it's very, very important that you make sure that you use condoms every time you have any kind of sexual contact. The second thing is it may be important for you to think about contacting people you've had sexual contact with. I think it's certainly important for you to contact your present lover, your present lovers, and you need to think about contacting anyone you've had sexual contact with in the last few years. The last thing I think is for you to understand that certain things you're going to do, like sexual contact, can pass the virus, and you need to make sure you use condoms. But other things don't pass the virus. It's okay to hold hands, it's okay to touch people, it's probably okay to, share a glass with somebody. But I think you ought to make sure that you're not exposing other people to any of your blood or large amounts of your secretions. Okay? Any questions about that?
Should I tell anybody about the test?
Well, I think it's important for you to choose carefully who you tell the results to. I think the most important thing for you, first of all, is to tell your support networks. We talked last time about what resources you had, and you talked about the friends and family members that might be helpful to you. I think you should decide who those people are and tell them so that you have allies to deal with this whole situation. Second of all, I think it's very important for you to think about telling your past partners, but I think the resources are really the key thing for you to decide who's going to be your resources as well as your past sexual partners. The other thing to think about is whether to tell your employer. I think it's very important for you to keep working now, and unless you have a new job that you're exposing others to your own body fluids, I think there's no reason for you to tell your employer. There's some tests I want to get on you now, that T4 test. We'll get those tests today, and then you'll come back in a couple weeks. We'll go over all your tests. We'll talk about if there's any medicines you should take, and we'll discuss any further questions you have at that time. To find out more about the closest testing and treatment centers in your area, contact the National AIDS Hotline. The first number, 1-800-342-AIDS, is a taped message with general information about AIDS. The second number, 1-800-342-7514, is a live number for physicians and the public that is available 24 hours a day, 7 days a week. In addition to referral information about testing and treatment, the AIDS Hotline can provide general information about AIDS in addition to counseling groups and crisis intervention in your area.
The opinions and approach to counseling described in the program are presented as an educational service intended for medical professionals only and not as a substitute for professional advice or intervention. They do not necessarily reflect the views of Roche Biomedical Laboratories and are not intended as a substitute for medical advice or education.